Hello everybody, it's Patrick Hutzel here again from Intensive Care at Home. And first of all, I want to wish you and your families a very happy and healthy New Year 2013. I hope you had a well-deserved and good Christmas break and you are refreshed to start a great new year. I also want to thank each and everyone who has been following Intensive Care at Home's blog for the last 6 months. The number of visitors to Intensive Care at Home's website have increased massively over the last few months and has now reached the 500 people mark, and I'm very proud of that achievement, to say the least. It also goes to show that the ICU community and health services in Australia in general are not oblivious to the need for new and innovative services that not only provide massive value and quality of life or quality of end of life to long-term ventilated adults and children with tracheostomy and their families, but also provide value to public and private hospitals and intensive care units in particular by saving money and resources that can be used for more acutely sick patients in need of a critical care bed. I also want to thank all the people that I have met in the last 6 months who helped and supported me getting Intensive Care at Home's idea out into the ICU community and opened doors along the way. It has been a very exciting and very interesting journey thus far, and as some of you know by now, I quite enjoy talking to and meeting new people. Now, in this video, I want to talk about 10 compelling reasons to provide intensive home care nursing for long-term mechanically ventilated adults and children with tracheostomy and their families. Now, this is the video version of my latest blog post, and you can also read through it if you go to our blog section. Let's dive right into it. Number 1 is quality of life and or quality of end of life outside of intensive care in somebody's own home and familiar environment, where they can feel at home and where they and their families can feel at ease, where they can relax and where they can have control. Number 2 is getting families' lives back on track rather than spending days and nights in intensive care whilst their loved one is long-term ventilated with tracheostomy. Now, families often put their lives on hold when their loved one is in intensive care. Putting their lives on hold often means neglecting their families, whether it's children or elderly parents or anybody else within the family. And far too often, some family members with professional lives and careers are unable to work whilst their loved one is in intensive care on a ventilator, and that very often leaves people taking paid and often unpaid leave in order to spend time with their loved one in intensive care. This very often leaves families in financial stress, in a situation where financial worries do not help the overall situation of having a loved one in intensive care. Number 3 is avoiding depression. Pretty much any long-term ventilated adult and child in intensive care with tracheostomy gets depressed, usually at the day 60 mark. That's probably no surprise to anybody who has worked in intensive care and has dealt with long-term ventilated adults and children with tracheostomy. For the listeners who haven't worked in ICU, long-term ventilation in intensive care leaves patients with no or very little quality of life in an environment that is sterile, busy, noisy, and it leaves patients with no dignity, no privacy, and very limited choices. My experience has shown me that despite the challenges of long-term ventilation with tracheostomy, taking a long-term ventilated adult or child out of intensive care makes such a massive difference to their and their family's well-being that taking long-term ventilated adults and children out of intensive care is a must, and it's a no-brainer. Number 4, avoiding and preventing hospital and intensive care acquired infections. I'm very certain that health professionals in intensive care have seen long-term ventilated adults and children with tracheostomy with hospital or intensive care acquired infections along their road to recovery. Hospital acquired infections either prolong the patient's recovery unnecessarily, or sometimes those infections can also be lethal and also add on to the already massive bill of a prolonged ICU stay. Furthermore, a usually already depressed long-term ventilated adult or child in intensive care doesn't need an infection on top of all the other issues they're dealing with. Number 5, giving health consumers, their families, as well as hospitals and intensive care units a choice. This is something that I can't stress enough. I strongly believe that any industry should be creating choice for their customers or for their consumers. The health industry is such a highly regulated industry that choice for the health consumer is very often not an option. This is for a number of reasons, including health professionals not offering alternative services in niche markets. But the health industry should, like any other industry, create choice and alternatives for their consumers. Number 6, maintaining stamina. Long-term ventilated adults and children with tracheostomy and their families not only get depressed, they also very often lose stamina along their stay in intensive care for a number of reasons, including depression, lack of quality of life, lack of privacy and dignity, and so on. Once again, just like with getting depressed in a hospital environment, stamina comes back once long-term ventilated adults and children are in a friendlier home environment, surrounded by their loved ones. And this is something I have seen over and over again, that every time a long-term ventilated adult or child is given the opportunity to go home with professional support, their and their families' well-being improve massively just by being at home. Number 7. Cost reduction and cost effectiveness. Intensive care is one of the most expensive specialties in the healthcare industry, and little has been done to improve its inefficiencies, whilst also providing real and tangible benefits to long-term ventilated adults and children with tracheostomy and their families by providing them with something they really want and they really need. In case you haven't heard me saying it, an ICU bed costs $3,000 to $5,000 per bed day, and intensive home care nursing is more cost effective, and it gets long-term ventilated adults and children out of a sterile hospital environment where quality of life can be restored. Number 8. Effective resource management. Resource management is another area with room for improvement for intensive care units and for hospitals. What if a long-term ventilated adult or child keeps occupying a bed for 50 days or more? What about all the hospital waiting lists, whether it be medical or surgical, or patients not getting in ICU beds within 4 hours from the emergency departments? By freeing up ICU beds, everybody wins: the long-term ventilated adult or child, their families, as well as the hospitals and their future patients. Number 9. Home must come before hospital. This one should be a no-brainer too. Hospital care has its unquestioned place, but there are times and there are health consumers where hospital care is detrimental to their recovery or to their and their families' quality of life. We should as a society explore any possible option in order to reallocate resources towards home care based models, as is the case in Europe and many other parts in the developed world, rather than focusing only on hospital care. As somebody said to me the other day, hospitals are designed for health professionals, not for patients. Number 10. Nurses and doctors can do it. I do strongly believe that intensive home care is the future model for long-term ventilated adults and children with tracheostomy and their families. I also believe that we as health professionals should not underestimate our ability and our unique skill set to provide services that are not fitting the norm but are extremely valuable and provide tangible benefits. When the first intensive home care nursing service providers came up in Germany in the late 1990s, a lot of people were against changing care models, changing their thinking and changing their paradigms. Now, 15 years later, it's unquestioned that the best and the only place for a long-term ventilated adult or child with tracheostomy is in their own home. Now, thank you very much for watching this video, and if you want to add on some comments and share your views, you can do that on our blog section. Thank you very much.